I work registration at Toronto General Hospital, and last month an American woman walked up to my desk, credit card already in hand, asking where she pays the deposit before seeing the emergency doctor. I told her there's no deposit. She looked at me like I'd just spoken Klingon. She kept insisting she needed to pay up front, waving her insurance card at me, explaining she has the gold premium plan with only a $2,000 deductible. I repeated there's no charge. She actually got angry, demanding to speak with billing because she knows how hospitals work and she's not trying to skip out on payment. 10 minutes later, she was still standing there, refusing to believe that walking into an ER in Canada doesn't require a credit check. My cousin manages a walk-in clinic in Vancouver, and an American couple came in last week because their kid had an ear infection. Before the doctor even looked at the child, the father asked how much the visit would cost. My cousin said it's free with a health card, but since they're tourists, probably $80. The man physically recoiled and said, "There's no way a doctor visit costs $80. What's the real price? Is it $800 or $1,200? Because that's what it costs back home." When my cousin confirmed it's actually $80, the wife started crying. Not because of the cost, but because she realized they'd been paying $300 per visit in Arizona for the exact same 5-minute ear infection checkup for years. The husband just kept saying this can't be right over while the doctor wrote the prescription. My roommate's a pharmacist in Montreal, and she says Americans are her most entertaining customers. One guy came in with a prescription for blood pressure medication, asked about the copay, and when she said there's no insurance accepted here, just the straight price of $15, he demanded to see the manager. He'd been paying a $40 copay in Michigan for the same pills. Another woman saw the price for her asthma inhaler was $35 and accused the pharmacy of giving her a defective, generic version because there's no way the real medication costs less than yen. She literally refused to buy it because she thought it must be fake medicine. The best part about working in Canadian healthcare isn't the actual healthcare system. It's watching Americans discover that medical bills don't need to rival mortgage payments, and then watching them get genuinely angry that they've been scammed their entire lives. My brother's a paramedic in Ottawa, and he transported an American businessman who'd had a mild heart attack during a conference. The guy kept asking about ambulance fees, insurance authorization, and which hospital was in network. My brother explained Canadian ambulances just take you to the nearest appropriate hospital. There's no network. The American actually argued with him mid-heart attack, insisting that's impossible. What if the hospital doesn't accept his insurance provider? He could be financially ruined. He demanded they reroute to a different hospital that he'd researched before his trip. One he knew took Blue Cross. My brother had to explain 3 times that they're going to the Ottawa Heart Institute because it's the cardiac center, not because of insurance networks. The man spent the entire ride calculating out-of-network costs instead of focusing on his cardiovascular emergency. He genuinely seemed more stressed about billing than dying. I run the intake desk at a Winnipeg ER, and an American tourist came in with a broken wrist from a skiing accident. Standard procedure, we took his information, got him through triage, x-rayed, casted, and discharged. He waited at the exit for 40 minutes because he thought someone would bring him his bill. When a nurse asked if he needed help finding his way out, he explained he's waiting for the financial counselor to discuss payment plans for what he assumed would be a $15,000 bill minimum. She told him bills go to his home address if he's uninsured, nothing to wait for. He insisted that can't be right. In America, you can't leave the ER without seeing billing first. They practically hold you hostage until you arrange payment. He actually said, "What if I just don't pay?" And she explained that's between him and collections, but he's free to leave. He stood there another 10 minutes, convinced it was a trap. My sister's a nurse at a surgical center in Edmonton, and they had an American patient scheduled for a gallbladder removal. The woman called the day before, asking if she should bring her checkbook or if they accept payment plans, because her portion after insurance would be around $8,000 in Texas. My sister informed her that as a tourist she'd be billed later, probably around $5,000 for the full surgery. The woman asked if that's the insurance negotiated rate, or the real rate? My sister said, "That's the actual rate, what the surgery costs." The woman started laughing, then crying, then laughing again. She said in Houston, the hospital billed her insurance $45,000 for the same procedure. Insurance paid $12,000, and she still owed $8,000 on top of her premiums. She kept saying, "You're telling me the actual cost is $5,000? The real cost." Like she'd just discovered her entire financial reality had been a construction. She had the surgery, and apparently spent the recovery calling family members to tell them Canadian healthcare prices like she'd uncovered a conspiracy. Work admissions at a Victoria hospital, and an elderly American couple came in because the husband needed his pacemaker checked. He brought a folder 3 inches thick, filled with insurance cards, prior authorization forms, referral documents, and payment history. I asked for his identification and insurance information for billing purposes since he's a tourist. He handed me the entire folder and started explaining his coverage plan, his secondary insurance, his Medicare Part B documentation, his supplemental policy. I stopped him and said, "We just need one insurance card for billing. We're not processing the claim." He stared at me like I'd spoken gibberish. He spent 40 years navigating American insurance bureaucracy, learning codes and tiers and networks and authorizations, treating medical appointments like legal depositions. The idea that a hospital just checks your heart device and bills you a simple amount later, no prior auth needed, no network verification, no coverage tiers, actually offended him. He said I spent 6 hours on the phone getting this authorized, and couldn't accept that those 6 hours had been completely unnecessary outside America. My uncle manages a pharmacy in Halifax, and an American woman came in with a prescription for diabetes medication. He told her the cost was $35. She asked what her copay would be. He repeated $35 total. She asked what it costs without insurance. He said $35, same price. She accused him of lying because her insurance negotiates rates. There's always a difference between insured and uninsured pricing. He explained Canadian pharmacies don't work with American insurance, so there's just one price. She pulled up her phone, showed him that in Florida, she pays a $50 copay for the exact same medication, and her insurance is billed $400. She did the math right there at the counter and realized she'd been paying $600 annually in copays, while her insurance claimed they were covering a $4,800 medication that apparently actually costs $420. She asked if this was legal. Not the Canadian pricing, but the American markup. My uncle just shrugged. I work at a medical clinic in Saskatoon, and we had an American patient who needed blood work done. Routine stuff, cholesterol panel, and thyroid function. I told him to go to the lab downstairs. He asked where he pays first. I said he doesn't. They bill him later since he's not a resident. He asked how much it would be. I estimated maybe $100 for both tests. He laughed and said, "Nice try, but blood work costs $600 minimum in Georgia." He's not an idiot. I pulled up the actual fee schedule and showed him. He took a photo of it, absolutely convinced he'd need proof of this when he told people back home. He went for the blood work and came back up 20 minutes later asking if the lab had actually done the tests because there's no way. Real medical testing happens that fast without charging premium rates. He'd waited 3 weeks for lab appointments in America and assumed speed equals luxury. Pricing my girlfriend's a receptionist at a dental clinic in my teen C. Regina, and while dental isn't covered by Canadian health insurance, an American guy came in for an emergency tooth extraction. They quoted him $200. He asked if that's with or without insurance. They said that's the price. He asked what the uninsured price was. They repeated $200. He asked what the cash discount price was. Still $200? He accused them of running a scam because in Alabama, the dentist quoted him $1,200 for an extraction, and his insurance covered $400, leaving him with an $800 bill. He said there's no possible way Canadian dentists perform the same procedure for a fraction of the cost unless they're undertrained or using substandard equipment. The dentist pulled his credentials, showed his degrees from the University of Toronto, explained the procedure step by step, and the guy still left convinced Canadian. Healthcare must be cutting corners somewhere because his entire understanding of medical pricing had been built on American markup. I'm a medical billing specialist in Quebec City, and we had an American patient call asking about a hospital bill she'd received for $1,200. After staying overnight for observation, she wanted to dispute it because her insurance should have covered more. I explained she doesn't have Canadian insurance, so this is the uninsured rate. She said that's impossible. Uninsured rates are always triple the insured rates in America. This must be a mistake. I broke down the charges for her, showed her the overnight stay, the monitoring, the tests. She went silent and then asked what this would cost in America. I said I don't know American rates, but based on what patients tell us, probably $12,000 minimum. She started laughing in this slightly unhinged way and said she pays $400 monthly for insurance premiums, and her deductible is $3,000. So she'd have paid the full $3,000 out of pocket anyway, even with insurance. She'd been paying nearly $5,000 annually for insurance. That wouldn't have helped her at all in this scenario. She asked if she could just move to Canada. I drive medical transport in Toronto and picked up an American woman from the airport who needed dialysis during her week-long visit. She asked if the dialysis center was in network with Cigna, I explained. Canadian hospitals don't have American insurance networks. She insisted every hospital has networks. That's how medical billing works internationally. I told her she'd be billed as an out-of-pocket patient. She started crying, saying dialysis in Nevada costs $1,200 per session with her insurance covering 80%. So she owes $240 per session, but out-of-network would be the full $1,200, and she needs 3 sessions while visiting. So she's looking at $3,600. I told her to call the dialysis center for the exact price, but it's probably around $300 per session uninsured. She didn't believe me, said I was just trying to make her feel better, insisted on calling. The center confirmed $275 per session. She asked them to repeat it twice. She spent the rest of the drive doing math, calculating that her American insurance charges her $720 monthly in premiums to provide coverage. That still costs more than just paying cash in. Canada, my dad works registration at a Thunder Bay clinic, and an American Hunter came in with a nasty gash on his leg. While getting stitched up, he kept asking when someone would discuss costs with him, because he needed to know if he should file this under his hunting accident rider or his general health coverage. The nurse said there's no one to discuss costs with, he'll get a bill mailed to him. He said that's not how emergency medicine works. You always know the costs up front, so you can decide if you want treatment. The nurse stared at him and asked if he was suggesting he'd have left his leg bleeding if the price was too high. He said, yeah, obviously. That's basic financial planning. He explained in Michigan he once left an urgent care with a dislocated finger because they wanted $800, and he decided he could just buddy tape it himself for free. The nurse asked how that went. He admitted it healed wrong, and he needed surgery later that cost $4,000. The nurse just went back to stitching. Work intake at a Calgary hospital and an American college. Student came in with appendicitis. Standard emergency appendectomy. Overnight stay, discharged next day. His parents flew up, and the first thing his dad asked me was about the bill, because they'd need to file a claim with their insurance company that has international emergency coverage. I said the bill would be mailed probably around $8,000 total. His dad pulled out his phone, called their insurance, and put them on speaker to ask about international claim reimbursement. The insurance rep explained they cover 70% of usual and customary charges and asked for the diagnosis code. After 5 minutes of back and forth, the rep said they'd reimburse up to $5,600 based on their schedule. The dad started arguing that the hospital charged $8,000. He should get 70% of that. The rep explained they only cover 70% of what they've determined is reasonable, not 70% of the actual bill. The dad hung up, did the math, and realized he's paying $2,400 out of pocket, plus his monthly premiums. He asked me what it would have cost in America. I said, based on what other patients have told me, $60,000 minimum for an emergency appendectomy. His son, still groggy from anesthesia, said, "Dad, we're being robbed by our insurance company," and his dad just nodded slowly. Finally understanding, my aunt runs a pharmaceutical distribution center in Vancouver, and she says the biggest culture shock for American medical tourists isn't the prices, it's the transparency. She worked with an American pharmacy for years and explained their system marks up medications. It's 300%, and then insurance negotiates it back down, creating the illusion of savings. In Canada, the medication costs what it costs, no games. An American pharmacist visiting for a conference couldn't believe she just tells patients the real price up front. He said that would destroy the entire business model because patients would realize they're being scammed. She asked what business model, selling medicine or selling insurance. He didn't have an answer. He went back to Seattle and apparently quit his job. 6 months later, to work for a non-profit pharmacy that uses transparent pricing. Said he couldn't participate in the con anymore after seeing how straightforward it could be. I teach a cross-border healthcare seminar, and an American doctor attended, legitimately curious about Canadian costs. I walked him through standard procedures, medications, hospital stays. He kept saying the numbers were wrong, too low, impossible. Then I showed him the American equivalent costs his own patients face, the $50,000 surgeries, $800 EpiPens, the $3,000 ambulance rides. He went quiet and said he'd never actually looked at what patients pay after insurance. He only sees what insurance reimburses the hospital. He'd spent 20 years practicing medicine without understanding the financial devastation his patients experienced outside his exam room. The system had insulated him from the consequences. He said Canadian healthcare isn't perfect, but at least it's honest about what things cost. American healthcare, he realized, is just elaborate financial engineering designed to extract maximum money while providing minimum transparency. The funniest part about these stories isn't that Americans are shocked by Canadian healthcare prices. It's that they go home, tell everyone what they learned, and half the people don't believe them. They'd rather maintain the fantasy that American healthcare is the best in the world than confront the reality that they're funding executive bonuses and shareholder dividends instead of actual medical care. Every single person I've told about $35 insulin just assumes I'm exaggerating. But I'm not. That's just what insulin costs when hospitals aren't trying to bankrupt you.